So tough competitors. So we after these two. So we are very happy to welcome two women, incredible women, Margaux and Noémie. So welcome and a big round of applause for you. So with you, we will stay a little bit in science. Margaux, so first it was very nice when we first discussed because you were so surprised actually to be nominated. And when we discover what you do, we are like, how can she be surprised? So you also come from a family of like 4 sisters, so it's a common link with you, Valentine. You have, oh, sorry, you want to, it's okay. You have a highly scientific background, EPFL in life science, then bioengineering. You went to MIT and Harvard Medical School. Then you came back to EPFL to do your thesis alongside with the CHUV in Lausanne around immunotherapy and micro-technology, right? Okay. Then you created ArcoScreen, okay, which is, so you will, of course, help us to discover what it is, but you said, oh, ArcoScreen is so easy, it's like a baking kit, like for kids, so you will see what it is. And meanwhile, you won also the Lopez Loretta Prize for your thesis, which is a very high-ranked science award. Okay, so Margaux, first, before you start with the ArcoScreen, just explain to us how close you are from science, right? And how did it start? Okay, because I understood it was kind of a family business, right? And science.
Yes, exactly. So when we discussed together, I realized it was a family business in a certain sense because both my parents are engineers, my mom in finance, and my father in microtechnology and microcommunications. So it's really, we are 4 girls, but I think we had an amazing role mother and role model in science and women in science. So I think that's really what brought us to science.
Okay, thank you. So explain to us how your thesis, run in collaboration with the CHUV, gave you the idea to create your project ArcoScreen.
So my thesis was done in collaboration with the hospital here, the CHUV, where we worked on cancer immunotherapy, so isolating patient cells, immune cells that could beat cancer. So that's a very promising new technology, cell therapy. And very interestingly, it laid the basis of ArcoScreen, not in terms of science, but in terms of skills. So how do you do project management with a collaborator? How do you deliver? How do you follow the milestones? We already had kind of a client during my thesis, so it's not purely an academic project like could be done with academia or a thesis. So we already had collaborations from the start. And the idea didn't come from my thesis, but my co-founder's thesis, but the foundation of the work we do at ArcoScreen and how we do it came from this project.
Okay, good. So now explain to us a little bit more about ArcoScreen and the final goal, actually, of ArcoScreen.
Yes, so at ArcoScreen, we develop new tools to do drug discovery on patient cells. So we can take any cells from any people, any organs in you, and we can test the drugs directly. So it could be used for personalized medicine. We could use it for diagnostics. It could be used for anything that you think where you're interested in knowing which cells and what you want to know about people. So this is very powerful. And that's really the final goal. But as you were saying, how it presents itself is like a baking cake. So you can buy it at the Margaux shop where you just need to add eggs and milk. So we do the same. We have a kit where pharma companies use it and they just add the cells they want to test and the drugs they want to test.
Okay, and then they mix it and then they mix it something or not.
Something good happens, hopefully.
Okay, so it's a very, very big accelerator, actually, of testing medics for like any cells, right? So it's the real purpose is really the acceleration.
It's the acceleration,
simplification,
and more efficient. So it's really identifying drugs that are more prone and more successful in clinical trials in humans very early in the drug discovery process. So instead of giving drugs which we are not really sure about how they act in patient cells before clinical trials, we can really identify their efficiency early on.
Okay, good. And last but not least, could you explain to us how science, or ArcoScreen, could really make our world a little bit better or more inclusive?
So in general, ArcoScreen, we are a fully women-led startup. So in terms of gender diversity in science, I think we already do our job in terms of inclusion. But more openly about science, what we do is innovation. And I think that's what has been said before. We create, we innovate as entrepreneurs, as scientists, but ultimately speaking, we want to give it back to society. And that's the phrase I've put here, the value of an idea lies in how you use it, so how you manage to make it usable by other people. And the goal of ArcoScreen is to help discover and empower pharma companies to discover new drugs that could be life-changing for currently incurable diseases.
Okay, good. Impressive. So, thank you very much. So, Noémie, so welcome. Okay, so you're a little bit at home for you, because Noémie, she's leading actually the sustainability for EHL here. So we had the chance to have you with us last year already. So
yes, my second year being an old one.
Exactly. So, and you're pursuing the journey of sustainability at EHL. So thank you very much, and please. Questions that you might have for Margaux.
Yeah, well, first I want to say, Margaux, I'm so impressed with you. So impressed by your scientific background, but by your passion, by your focus. I myself am more a humanities kid. I studied French, English, and philosophy. And so I tried to find our similarities, and what I came up with was ethics. We know the power of science, and we know that the most powerful innovations can be sometimes limited by human greed. So do you see any ethical risks with ArcoScreen?
So there are risks. Being a tool, it can be used in either ways, good or bad. Hopefully how we intended to use is ethical. And how we decrease this ethical risk at ArcoScreen is by really identifying key partners that follow our mission and have the same vision as we have, so that we really can distribute the technology to as many people as possible to use it in the right way and have the ultimate goal of doing new drugs to cure people.
Okay, great. And related to sustainability, science labs are typically known to have large environmental impact. So high levels of consumption of water, of plastic. How do you try to address that?
So I think that's a very good question. Thank you for asking it. Every time we take people, my sisters, everybody in our lab, they say, how much plastic do you use? And the answer is easy for us. It's like, yes, but we work with cells. We cannot contaminate them. We can hardly clean things properly to do cross-contamination. But I think it's a very big issue that now people are trying to change the way we do science and biology, and integrating recyclable material or changing the way we clean materials. So how we help in terms of sustainability is by we combine microtechnology with biology, and so by using very small amount of reagents, we can spare a lot of reagents and cells that are used. So we try to do much more testing with the same amount of reagents currently used. And then, of course, also we try to use reusable materials, so cardboard, and try to avoid plastic, but that's unfortunately not the standard in the industry, so we need to change the mindset of the industry, but we try to make it happen.
Great. I also saw on your website that one of ArcoScreen's values is a world-changing mindset. So in your dreams, what major changes will you bring?
So one of our other values is curiosity, and I think this is where it drives us. So we are all curious in the team, and we want to change the world by basically providing those new tools. So for us, the goal is not to provide new tools and to get the product on the market or to increase our team, as it has been said before. What we really want to change is how people do drug discovery. Because today, when we discovered pharma as a naive scientist, we were really astonished how people have no idea of how drugs are done and what really they do in people's cells. And before going into clinical trials, so you put those drugs in people and you have no idea of what they do. And for us, this is really how we can change the world, is by getting more information before and basically making people safer when they do clinical trials. And then, yeah, trying to cure people. That's really very naive as a scientist, but I think that's also what drives us.
Great. So well, how do you see ArcoScreen in 10 years? Where will you be?
So hopefully we will have other people that are much more competent than me to bring this company much further away. So as a scientist, we are very good at the beginning. So we have the science, we have the knowledge. But then ultimately speaking, when we want to do a big company and we want to be profitable, either we have to partner, so with big pharma companies, and we already work closely with them because they know their need and they know how we can basically implement our product in their processes. So in 10 years, hopefully, our technology will be everywhere in all pharma labs, and we could have a real impact by having new drugs that would have been discovered using our technology.
Okay, great. And so you work with a lot of big pharma companies. How do you choose them? Do you screen them?
Yes, so we screen them.
It's okay, you have time.
We screen them in terms of so it's not at all based on what they present or their official visions and mission. It's how we are received as innovators. So it's how we interact with the people that work there, because it's the people who will use our technology. So ethically, if we want to know how our technology will be used, we need to know the people who will be using it. And that's very important for us, how we are received, how people think about innovation, and how they really have this long-term vision of drug discovery.
Thank you very much. Perfectly on time. So very impressive. Now questions from you, from the audience. Alors, for Margaux first, do you have other ideas already in mind for future research? Cheese.
So yes, we, of course, as scientists, we love to do new things. It's harder when we have to push it to do something real then. But ideas we always have a lot. So the technology is extremely versatile, so we can work with any human cell, and for now we focus on specific drug targets that are involved in everything you do. If you can smell, if you can taste, if you can see, if you can think, it's thanks to them. So they're very important in drug discovery. But as said, we use it for drug discovery now, but it could be used for diagnostics, it could be used for personalized medicine, it could even be used for screenings in terms of who might be selected for clinical trials and so on. So the same technology can be turned around and fine-tuned in a huge variety of products and other ideas. So that's also the beauty of science.
So I hope you're going to have a very, very long life, right, to make that happen, right? We need that.
But ultimately speaking, with my co-founder, our next venture is a small bar in the Caribbean. So
also good. So we understand that.
No more science, maybe only mixology.
Or you could have a clone.
Yeah,
exactly. So yeah, exactly. So very good. So in terms of risk, of course, in science, we might see a few. And what do you think about, like, what's your opinion about cloning? You see there a risk, or what's your perception?
I think in science, and in particular when you have journalists that talk about science. I'm sorry if there are journalists in the room, but people tend to oversimplify things. And working in biology, you have this living component. So you have things that we study biology for years and years, and you never really understand what happens. And I think we have examples of cloning, but for me, it's still very, very long and far away on how we can use it for humans. Because there's such a huge complexity. I mean, I've seen heart cells beat in the lab, and it's just amazing. You always think, like, what's happening? How does it beat by itself? There's like magic of life. And I think that's something it's hard to reproduce.
Okay. Okay, so let's keep the magic, maybe. Noémie, so we were, as we were saying, we were lucky to have you already last year. Last year you were really in the middle of the works for the new buildings here. So you talked a little bit to us about the way you were seeing the sustainability, or the way you were developing all these buildings in a sustainable way. So are you already able, actually, now to assess your impact in terms of sustainability now at EHL?
I would say yes and no. First of all, the biggest, where we think we could have the biggest impact is by creating the sustainability mindset in our students. And that's probably the one that's the hardest to measure. We can look at our alumni, we could look at the types of careers that they have, but the idea is really that they go and have positive environmental and social impact during their careers and create that snowball effect. Now, of course, when we started on our sustainability journey at EHL, the first thing we started doing was putting KPIs and measurements in place, because there's no way you can do sustainability without really knowing if the initiatives you put in place have an impact, if they're successful or not. So we do have a yearly environmental and social report that has a lot of measures in each material topic in our sustainability strategy. Education comes first, but there's also, of course, the environment, caring for our people and giving back to communities. And we do measure a lot of our progress.
Okay, so it's something to still follow, and that you have already started and.
Yeah, we've started. It's a journey. Like
dynamics.
I said, sustainability is never going to be over. It's also a very, very complex topic. If you start pulling one spaghetti string, the whole plate comes with you. So, of course, it's never going to be finished, but we're really making good progress. And yeah, on the environmental side, we've reduced our carbon footprint by 20% since 2019.
Okay, good. Thank you very much. So thank you to both. So it was Margaux, bigger than yourself, Margaux, fighting for a more sustainable and efficient science. So thank you very much.
Thank you.